Hello, my name is Dr. Dmitry Tsvetov, Temecula facial oral surgery, and today we're going to talk about a very exciting procedure which is called all-on-4, sometimes also referred to as teeth in a day. What exactly is an all-on-4 procedure? As you can see from this model, essentially it means that 4 dental implants are placed into the dental arch. This allows for the subsequent insertion of a bridge, a dental bridge, which actually gets screwed into those 4 implants with the little screws which are hidden inside of the teeth. This particular procedure has been around for about 20 years, and more people are coming into my office inquiring about it. So I just wanted to make this video so that you can also look at this information at the comfort of your own home, and if you would like, you can then come into my office and spend some time with us to see if you may be a candidate for this particular procedure. Let's look at this in a little bit more detail. The patients who are candidates for this particular procedure are typically those that have a full arch of non-salvageable teeth, meaning if 1 or 2 of the teeth are non-salvageable in a dental arch, traditionally we would not recommend this particular procedure. However, if most or all of the teeth are in a very bad shape, then you definitely are a candidate to have this procedure done. Also, those patients who have severe uncontrolled periodontal or gum disease also can be candidates for the procedure, especially in cases where all of the teeth in an arch are either loose or failing. There's also a subset of patients who either do not want to wear a removable complete denture or a plate, or those who actually cannot even tolerate it. For example, patients with severe gag reflex. Those patients would also be candidates for this particular procedure. So what is the advantage of the all-on-4 or the teeth in a day? Well, there are many advantages. The first one is that this particular procedure can be completed in as little as 4 hours in an office type of a setting. Before the surgery is even carried out, the whole procedure is planned on the computer. That way, custom computer-generated implant guides can be made, which allows for increased precision of the surgery, less surgical time, and subsequently less recovery time as well, because the surgery is shorter and it's more precise. If desired, patients can be put to sleep for the procedure, or we can also do this procedure under local anesthesia. Another advantage of this is that typically this procedure can be carried out without the need for additional bone grafting. Typically, before this procedure was invented, patients needed large bone grafting procedures, especially in the sinus areas of the top jaw. This can be completely avoided because with this particular procedure, the posterior implants are tilted to avoid engaging the maxillary sinus, and this again allows for more predictability and greater clinical success of this particular operation. And last but not least, the main advantage is that the same day when patients come into the office for their procedure, they leave the office with brand new teeth, which look and function a lot better than the ones they had before. We often get asked, well, what can I expect after the procedure as far as my recovery time? What I usually tell my patients is that a good estimate is that the first 1 to 5 days after the procedure can be a little bit difficult in terms of the swelling and the bruising. However, as long as you apply ice to the jaw and you sleep elevated on a couple of pillows for the first few days, those effects can largely be somewhat mitigated. During the first few weeks, we typically see a patient at least once per week for routine follow-up visits, just to make sure that everything is healing up well and that there are no issues. Subsequently, during the second through the 6th months after the procedure, we typically see the patient about once a month. Once you have 6 months elapsed from the procedure, the patient follows up with his general practitioner for routine dental cleanings and visits. During that time, the prosthesis is removed by a general dentist, the implants are cleaned, and then the prosthesis is attached back. Let's look at a specific example of a patient who underwent this procedure. So this patient presented to my office, and her chief complaint was that she wasn't happy with the way the teeth looked or how she functioned. You can see from the front and the side pictures that the aesthetic appearance of the teeth can be improved. And again, the way the teeth came together didn't allow her to be able to chew well and not to be able to enjoy the foods that she otherwise would like to. This is a view of the teeth from the top, and you can see that there are a lot of retained root tips, which are pretty much non-salvageable at this point. And the teeth that she has remaining, they have decay, and at this point, trying to pour more financial resources into trying to restore these teeth would not be an advisable approach. On the X-ray, again, we can see that there are multiple retained root tips present, and the rest of the teeth are not functional for the most part. So this is the picture during the surgery, and here we can see the custom-made computer-generated implant guide that again allows for a specific placement of the 5 implants in very strategic spots to maximize the success of the subsequent prosthesis. This is the picture that shows attachment of what we call transfer copings. So these are little metal cylinders that are attached to the implants, which are now inside of the bone. And the reason for these transfer copings is that they now allow the prosthesis or the teeth to be attached to the underlying implants. So this picture is showing the attachment of the brand new teeth to the transfer copings while the patient is biting down to ensure proper positioning of the bridge. This is a view of the brand new prosthesis from the underside, again showing us the transfer copings which were attached to the implants but now are unscrewed from the implants once the attachment process has been completed. The postoperative X-ray is showing us successful placement of the 5 dental implants. So this ended up being a Noland 5 as opposed to the Noland 4. And this was accomplished in order to increase the stability and the retention of the prosthesis. And on the postoperative view of the patient, we see a much better aesthetic outcome, and of course the functional outcome is a lot better as well. So I would like to thank you for your attention, spending some time with us listening to this presentation. Here at Temecula Facial Oral Surgery, we offer free evaluations and free consultations for the Noland 4 procedure, including X-rays. Please give us a call, come in and see us, and we can evaluate whether or not you are a good candidate for the Noland 4 procedure. Again, thank you so much for your attention, and we look forward to seeing you soon.